China is trying to track down over 190 people who may have come in contact with a man with MERS, the country's first confirmed case of the virus. The case was confirmed on Friday after the patient, a South Korean man who showed symptoms of the viral illness back home but ignored doctors' advice and traveled to Hong Kong. The 44-year-old man later entered Huzhou City in South China's Guangdong province. He had close contact with the Middle East Respiratory Syndrome patients at home and expressed discomfort as early as 21st May. Health authorities have put the man under observation in isolation early Thursday morning and also isolated people who had close contact with him. A total of 38 people have been known to have close contact with the man.
Our test results have shown no positive cases of those who had close contact with the patient. The patient is currently in stable condition.
Hong Kong health authorities have confirmed a list of 29 passengers boarding the same flight with the patient to have close contact with him. They have contacted 12 of them, with at least 10 others feared to have left Hong Kong. Earlier, Seoul confirmed that 10 South Koreans have been infected with the Middle East Respiratory Syndrome virus. These include the men who traveled to China. As the number of infected persons rose in South Korea, it paced efforts to deal with the cases.
After the first case was confirmed, we dealt with it in different ways. However, none of those ways are sufficient. Above all, we need to intensify efforts to prevent transmission by isolating confirmed and suspected patients.
Middle East Respiratory Syndrome is considered a deadlier but less infectious cousin of the severe acute respiratory syndrome virus that appeared in Asia in 2003 and killed hundreds of people, mostly in China. Symptoms may range from flu-like aches and pains to pneumonia and kidney failure. MERS was first identified in humans in 2012. Last week, South Korea's health ministry said there were 1,142 cases of MERS in 23 countries and 465 deaths had been reported by May 16. There is no vaccine or treatment for the disease, which has a fatality rate reaching 40.7%. DD News.